All right, this meeting's called to order. Good morning and welcome. This is the first of our 2 June SEB board meetings this session, or the season. We already had session, that's done. We're in season now. Our meetings this year are going to continue to be hybrid. HCA staff will be on site, and board members and other attendees have the option of attending on site or via Zoom. For our members of the public attending via Zoom, our opening slide has information on how attendees can turn on closed captioning subtitles. Also, public meeting attendees will be able to activate their audio and video during designated public comment periods. Board member intros. We're going to do roll call. Pamela.
Good morning.
Morning. Donna.
Good morning.
Good morning. Lara.
Good morning.
Good morning. Carrie.
Good morning.
Good morning, Myra. Good morning. Allison, are you with us virtually? You sicky?
I am. And
how are you feeling?
You all will be glad I am not there hacking on you. So I feel very like a very responsible citizen.
Are you feeling a little bit better today?
I'm going to tell you yes, but really
okay.
no.
That's no. Allison is sick. Okay.
Fake it till you make it.
I will stop talking to you then and let you just be sick. Terry.
Good morning.
Good morning. Omid.
Morning.
And Katie Hatfield.
Hello, everybody.
Good morning from the Attorney General's office. And I'm Lou McDermott, the agency's COO and chair of the SEB board. With board members attending both in person and virtually, it's helpful to the board to hold their questions until each presentation is done or when the presenter pauses and asks if there are questions. Board members attending virtually, you can raise your Zoom hand. And if you're in the room, raise your real hand. We have one resolution scheduled for today, and the public will have an opportunity to provide comments on the resolution during the normal procedure before we vote. The public is also going to be able to provide general comments at the end of the meeting during the public comment period. At those times, public participants will need to raise their virtual hand so that they can be recognized by HCA staff, and we'll be able to activate your audio video options. And as a reminder, if the public has questions during the presentations, the presenter's contact information is included at the end of the presentation, and they're welcome to send email for responses from the agency. And Dave's going to give us an overview of today's agenda.
Good morning, Chair McDermott, members of the board, Dave Eisbinger for the record, and a reminder to turn on your microphones because that's how everything gets recorded and everybody can hear us better. Today we have a brief public meeting, first to talk about the long-term disability resolution that was introduced at the last board meeting and asking for your action on that today. Then an update on UMP Plus. As we know from the legislative budget, that plan is closing at the end of the year, and so beginning to talk about that process. And then an update on the Smart Health Program from John Parton. You might notice that this is the first agenda this board season where we don't have benefits 24/7 update on. We're going to continue with monthly updates. So as we move into June and July, and we have multiple meetings, we're not going to come every meeting, but we will have an update later this month at our second June board meeting. So 2 other reminders. Oh, then we'll go into executive session, and that will be the bulk of our meeting as we begin or continue working through the rate development process with you. 2 other housekeeping reminders. If you need the bathroom, walk down the hall, look at elevators, turn left. If there is an emergency, we walk purposefully across to the visitor parking lot right over there. And with that, I will hand it back to you, the chair, for the minutes.
All right. Any questions from the board? Okay. We're going to do the approval of the May 8th, 2025 meeting minutes. They're behind tab number 3. Are there any comments from the board? Seeing none, do I have a motion to approve the minutes as written?
This is Myra. Motion to approve the minutes as written.
Is there a second?
Pam Cruz, second.
All in favor, say aye.
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 Any opposed? Hearing none, the May 8th, 2025 minutes are approved as written. Next up, we have a long-term disability benefit resolution. Kimberly Gazard, Senior Account Manager in ERB, is going to be bringing back a resolution for voting that was introduced at our last meeting regarding the increase to the SEB program employer-paid long-term disability benefit. After Kimberly reviews the resolution, I'm going to ask for a motion to adopt. A second. I'm going to invite the public to comment on the resolution. We're going to ask for discussion from the board until we're ready to vote. And again, the public is going to have their opportunity to comment before the resolution gets voted on. Materials behind tab number 4. Kimberly, welcome.
Kimberly's remote.
Ah,
And you have a guest waiting outside for you for a moment.
got it.
So Kimberly, go ahead. I think we're getting you into presentation status. Kimberly, I think the piece is on our end. We can see you now. And you're muted, so we can't hear you, but I don't know if you can hear me. So you can hear me, you're muted, and we're working on your audio. Can you make sure that you're unmuted on your side? It looks like you're still muted, Kimberly, on your end, and we don't have the capability to unmute you. Can you jump out of and sign back in, Kimberly? Okay. We're still working on audio technical capabilities. Kimberly is signing out and signing back in. We couldn't get her audio on. Okay. Yeah. Did she sign back in yet?
It was straight because we had the online board member be able to. Yeah.
Yeah.
I think it's on. I think it's on Kimberly's end.
You have the phone. Oh, okay. Yes, we have the audio separate from the video.
That
We do that.
that is an option. I think so. Yeah. Uh, she's about to try.
Can you hear me?
Oh,
Yep.
yeah, here we go.
Wonderful. Okay, that worked, logging out and coming back in. All right, ready when you are. All right, well, can you hear me? Can I just make sure everybody can hear me? Can everyone hear me?
Yes.
Okay, perfect. All right, well, sorry about that. I'm Kimberly, and I'm here today to talk about the long-term disability benefit resolution. So for slide 2 here, we had a SEBB board question from last month about a subscriber who was on an employer-paid LTD claim prior to January 1st, 2026. And if the subscriber would be eligible for the $450 increase beginning January 1st, 2026. We confirmed with standard, and the increased employer paid LTD benefit amount of $450 would apply to claims incurred on or after January 1st, 2026. LTD claims incurred prior to January 1st would not be impacted by the increase to the 450. This aligns with how the Washington State's paid FMLA is administered, which Dave highlighted at last month's board meeting. And any questions before we move on to voting for the LTD policy resolution?
So Kimberly, just for any members of the public who might have felt that was a little insurance gobbledygook language, that means if you're already have a claim that is being paid out and the value of your claim is locked into the date that your claim begins. And so somebody who's currently on disability right now receiving a claim would continue at the $400 level. Sorry, SEB $400 level. It's only new claims that start or initiated after January 1st that get the value of the new benefit.
Any questions? All right. So the resolution, can we see the resolution? Next one. Is it? Oh, it's both of them. Well, it's a long one. So it's in your book. And under the rules, it's acceptable to not read the full text of the resolution as it's been distributed. Is there any concerns from the board just to vote on it without reading it? Seeing none, hearing none. Thank you. I need a motion to adopt SEB 2025-01, amending SEB Resolution 2021-13, employer paid long-term disability. Is there a motion?
Pam Cruz, I move the adoption of Resolution SEB 2025-01 as presented.
Is there a second?
Myra Johnson, I second.
Are there any comments from the public? Nope. Any comments from the board? All right, this will be a roll call vote, starting with Pamela.
Aye.
Donna.
Aye.
Lara.
Aye.
Carrie.
Aye.
Myra.
Aye.
Allison.
Aye.
Terry.
Aye.
Omid.
Aye.
And Lou McDermott, aye. Resolution 2025-01 passes. Thank you for not having me read that. I appreciate that. It's a long one. Yeah. And now we have a UMP Plus update.
Still have a few comments from Kimberly about next steps.
Okay, sorry about that.
No worries. Next steps are to issue notifications to SEB organizations and subscribers on this resolution, and we will also incorporate the resolution into our overall SEB program communications. Thanks, everyone. Appreciate your time.
Thank you. All right, next up, we have UMP Plus update. Lauren Johnston, Senior Account Manager in ERB, is going to go over some more information regarding the SEB program's UMP Plus plans closure, which is taking place at the end of the year. Materials behind tab number 5. Welcome.
Thank you, Chair McDermott, members of the board. My name is Lauren Johnston, and today I'm going to be providing an update on the UMP Plus plans. Next slide, please. Okay, so a brief history.
Can we get your microphone closer to you?
Yes, hang on just a second. These are new. I haven't used this one yet. All right. So a brief history of the UMP Plus to include enrollment. We're going to go over the recent budget legislation and then what is happening next with the UMP Plus plans. Next slide, please. All right, so a brief history of UMP Plus. HCA submitted a request for application in 2024. 2014. in order to evaluate the health system's readiness and capacity to deliver integrated care. The intended purpose of the program was to move from a fee-for-service model of care to paying for value, a core strategy of the State Healthcare Innovation Plan, also known as the Healthier Washington Initiative, which was established by the state legislature in 2014 with the passage of Second and Gross Substitute House Bill 2572. By implementing the UMP Plus plans and its networks, the healthcare authorities sought to increase the usage of value-based contracting, increase payment incentives that promote quality, efficiency, cost-effectiveness, and health improvement. The UMP plans started in the PEB program effective January 1st, 2016, and were later offered to the SEB program with its enactment on January 1st of 2020. Next slide, please. This slide shows the UW Medicine Accountable Care Network ACN SEB program enrollment, as well as the current 2025 service areas. Next slide. And this slide shows the Puget Sound High Value Network SEB program enrollment, as well as its current service areas.
Lauren, is that total members or is that subscribers?
Total members.
Got it. Thank you.
And for the board's recollection, the service area has expanded and contracted a little bit over time since I can't remember pre-SEB versus post-SEB days, but over the last decade, there's been some expansion, contraction. There's been counties that have flipped from one network to the other because of some of the core providers, but it's been generally centered around the I-5 corridor, Puget Sound area, along with Spokane, and then there were some fortunate expansions into South Central and Southeast kind of Washington area over time. So if you remember other counties beyond the list, there have been over time, there's been a little bit of adjustments year over year, but it's generally been a pretty stable service network area.
Okay, next slide, please. All right, so some recent budget legislation. So recently was passed in gross substitute Senate Bill 5167. So section 909 subsection 4 states that the funding rates in subsection 2 of this section are not sufficient to continue offering an accountable care plan as of plan year 2026. I believe that one is for PEB. And then SEB is section 910 subsection 1B. The funding rates in section 5064 of this act are not sufficient to continue offering an accountable care plan as of plan year 2026. All right, so what's next? The UMP Plus plans will go through the following process. Ultimately, the plans will end on December 31st, 2025, 11:59 p.m., just in case. We will have a robust communications plan and outreach with subscribers before and during annual open enrollment. So this will include receiving notifications from the Healthcare Authority, both of the networks, as well as Regents. We have confirmed with Regents there will be no continuity of care issues. So because the providers within the UMP Plus plan are also part of the Regents network, those members will be able to continue to see their current providers. We have also confirmed with them that there will be no issues with prior authorization requests being honored as well after January 1st for those members either. There will be, go ahead.
Question, is it for I'm assuming it's for members who stay within the Uniform Medical Plan. If
Yeah.
they were to go to KP,
Exactly.
that's a
Good
different
call out.
ballgame.
Yes,
Okay.
members have to stay within UMP and with Regents in order for all of those things to happen. There will be updates to enrollment forms, enrollment guides, as well as benefits 24/7, et cetera, making sure that we have all of our systems ready to go for these changes. There will also be closeout activities that are contractual obligations between us and the networks. So what if subscribers don't elect a plan for 2026? I'll be okay to announce it. Okay. HCA will default subscribers and any enrolled dependents into either the UMP Classic plan for PEB or the UMP Achieve 2 plan for SEB. which is different from the normal default plan for SEB. Usually it's Achieve 1. So we just felt after kind of doing an analysis of current costs, premiums, et cetera, that those members would have a smoother transition over into the UMP Achieve 2 plan if they do not elect a plan. That way it won't be so much of a shock to them.
Yeah, and I think just to add a little bit more context to that, the benefit design, one of the big pieces of benefit design is a lower deductible and free primary care visits. And if you look at Achieve 2 and Achieve 1, Achieve 2 has the next lowest deductible within the portfolio, and there is not a comparable piece to the $0 primary care visits. But one of the other differences between Achieve 1 and Achieve 2 is one of them is a 20% coinsurance, one of them is 15% coinsurance. So in general, there was a lot more similarity to the benefit design of Achieve 2 than there was Achieve 1. One of the weighing in the other direction, though, is Achieve 1 has a much lower premium than even UMP Plus does, and Achieve 2 has a higher premium right now. I think Tanya has described, if she hasn't, I'm just going to say it now but in PEB, we had the phenomenon this year where the UMP Plus monthly premium exceeded UMP Classic, which is the similar plan to Achieve 2. So it was costing more, whereas up until this year, UMP Plus had always been a lower premium with a richer benefit. We are on the same trajectory in SEB for UMP Plus if it were to continue as a plan to overtake the UMP Achieve Premium 2 within about 1 to 2 years. And so we haven't crested there in this portfolio, but also, that dynamic that they were kind of coalescing, we thought that even though some people will see a higher premium if they are defaulted into UMP Achieve 2, that is the trajectory they were on from a premium standpoint in the next year or two already. And so we felt a little bit more comfortable. The decision is actually easier in PEB because UMP Classic is less than UMP Plus, but here there were some direct, pointers in each direction for what the default plan could be, Achieve 1 or Achieve 2. And we just felt more pieces aligned with Achieve 2. And so that's the intent here. Again, that's for people who don't make an affirmative election. We will do everything we can to get the roughly 12,000, 13,000 member lives for those subscribers to affirmatively pick a plan, make sure they know if they stay within the UMP portfolio, that they won't have continuity issues, that they don't have to do pre-authorization. They obviously have the choice of any carrier within the portfolio. They could go to either of the Kaiser because there's no overlap with Kaiser Northwest service area. They could go to KPWA options or Primera, but if they stay within UMP, they have the benefits of not having any concerns about provider disruption or new prior authorization.
And I'm assuming in the communication, we tell them what happens if they don't do anything.
Yes.
Yeah, cool.
And some people will choose not to go into the system because they're like, oh, I like what the default, they're telling me what they're going to do. I'm fine with that. It's always kind of a risk. We like the automatic enrollment or default rate to be as low as possible, but at the same time, we do advertise what will happen if there's no action taken. And some people are like, great, then I'm not going to worry about it because that's what I would do anyway. So any questions about the default automatic process? We always share what the intent is for those, and then would absolutely listen to concerns about that. But we feel like we've honed in on that final decision at this point.
Okay, and next slide. At this point, I am free to take questions.
Anybody have any questions? Well, dang. I stole everyone's thunder. Okay, next presentation, I say nothing. Thank you, Lauren. All right, John Parton, our Benefit Strategy and Design Section Manager in ERB, is going to be providing an update on Smart Health materials behind tab number 6. That's the last you're going to hear from me, John.
I think that remains to be seen.
Yeah, well,
I may
sometimes I can't help
necessitate-
myself.
Yeah, I may necessitate your involvement. Thank you, Chair McDermott, members of the board. I just wanted to give a brief update today on what's happening with Smart Health. So this is a combination of what we typically do, what's been the engagement rate so far throughout the year, and then the legislation that impacted Smart Health or will impact Smart Health in the future. So if we advance to the next slide, please. wanted to call out that Smart Health has been around for about a decade, started in 2015. It's a component of the Washington Wellness Plan. It's not the totality of the plan. Was originally implemented to expand the effectiveness and the engagement of the wellness program offerings. At the time, and it still does, offers an online engagement portal, wellness portal, as well as a $125 wellness incentive for engaging in those wellness activities within a plan year. Go to the next slide, please.
Hey, John,
Yep.
What else is part of the Washington Wellness Program that isn't Smart Health?
So it's a great question. We'll come back to it, but quickly, there are a number of things, including smoking cessation, diabetes management, diabetes prevention programs. All of those are also part of the wellness program, and we'll talk about what's going to end as a result of the recent legislation. Those components will continue beyond the end date for Smart Health. So the current engagement numbers just highlight that the 2025 was year to date as of May 12th. So these are not complete, but they're running pretty similar to what we saw in 2024. You'll notice a pretty significant gap from what we had in 2023. There were a number of factors that influenced that drop in participation, not the least of which were we changed platforms and vendors that offered the platform and manage it. But we also changed the security sign-on to get into the wellness platform and went to the state standard, which includes SAW validation of your login. So both of those things kind of contributed to the drop that we saw from 23 to 24, and we're still kind of recovering from those. So that's the current number. And just to explain, eligible is the total eligible number of subscribers that qualify for the program. Registered are those that actually logged in and registered to participate with it. The WBA is the well-being assessment. So it's similar to a health risk assessment, but it's more focused on a holistic well-being of the patient. And so for those that completed that well-being assessment, it's not terribly short. It's not horrendously long, but it's pretty involved. You can see there were quite a few that did. And then once you've completed that, you had to complete a number of additional activities within the program to qualify for that $125 incentive. So that would be the last column, are those that actually earned the incentive in each of the years or have year to date for 2025. We move on to the next slide, please. So the legislation, we had Senate Bill 5807. I've included the relevant language from 5807 in the appendix, but essentially the key points, it calls for the online portal and the wellness incentive components of the program to end by January 1st, 2028. So in a nutshell, what that means is folks will continue to be able to access the portal and engage in those wellness activities within Smart Health through 2025, 2026, 2027, and they can earn for the future year then the incentive, and that final incentive will be paid out in January of 2028. The portal will be taken down at the end of 2027. Folks won't be able to access that or have access to the incentive piece after that. So as Dave called out, the important thing is that's not the end of the wellness program. It's the end of one component of it, a major component, but it's not the sum totality of the wellness program. And we'll have those other things like the smoking cessation, diabetes management, diabetes prevention, and some other things that we're looking at for the future that are already offered through some of our payer partners. Those kinds of things will continue unaffected. The key in that language moving forward is that anything that we do offer has to be evidence-based. So there has to be strong support for you do those activities, you engage in those activities. There's a definite clinical payout for you, right? Not a financial payout necessarily, but there's a clinical improvement in the patient's well-being, their life, their clinical outcomes. So I'll pause there. That's a lot in a very brief moment of a slide. Any questions on that piece? Okay.
I'll just reinforce that we don't anticipate bringing anything to the board for action this season, next season, maybe in 2027. There might need to be some sort of repealing of policy decisions that have been made, and we'll unwind the rules and during the rulemaking process in 2027. But don't expect too much. We're just going to kind of be status quo on, advertising and engaging and having people participate in the program for the next couple of years.
So if we go to the next slide, we will see most of that, right? Which I appreciate, Dave. It saves me having to say it, but yep. Sorry, Lou, I was trying to save it for you, but so we'll bring back the closure and the communication plans around this, likely in 2026, so that you're aware before 2027 hits and we're undertaking those activities. We'll want to make sure that we capture all the lessons learned through the program because there've been some very significant learnings. There's some data sharing arrangements and file record retention that needs to occur, but not only with HCA and WebMD, who manages that portal for us, but also with our payer partners. We'll need to close the contract between HCA and WebMD. They're aware of this. We've been talking with them consistently about it. And then, as I said, this has been around for a decade, and there have been some significant successes that the program has delivered. And so we'll celebrate those with the team. And as Dave mentioned, likely be back with some board action in 2027 to close things out, kind of the ticks and ties.
Yeah, I'd just like to point out there's going to be multiple legislative sessions that are going to take place. Anything can change, and there's also bargaining, and anything can change there. So I'm glad you guys are taking your time in the unwind and doing things when appropriate.
And the really important point that Dave mentioned is the team is focused right now on ensuring that members continue to engage in the wellness activity and earn those incentives for doing the activities that are associated with them. So that's really our focus over the next couple of years, and then we'll start to transition into, assuming that everything stays as is, and that 1/1/2028 end date, we'll transition into that kind of wind down sometime in 2027. But more to come. So questions?
Just to be the yin to lose yang, and I did look at the next slide to make sure I wasn't taking it. This time, well, I swear I looked and I just flipped past that page. Yes, there are multiple sessions and anything can happen. We also expect that the next couple of sessions, or at least the next session, is going to still have a lot of financial challenges. And there is much that will be impacted in our state and other states by whatever final decisions are made about the federal budget. So I say that to temper expectations because there have definitely been people who said, oh, this could change around in between now and 2028. It's like, it is theoretically possible. I think it has a lot of hurdles. As Tanya and I tried to highlight in the budget conversations this year, there are very few ways for these programs to immediately impact the budget. There's often long on-ramps to bring something up or take something down. And that's why we're talking about this now in 2025 for 2028. So yes, anything can happen, but I just don't want to give people too much false hope, but I also don't mean to rain on everyone's parade either. It is certainly possible, but just temper expectations.
Any questions for John? John, thank you.
Thank you all.
All right, we'll now reach the public comment section of the meeting. First, we're going to get a list of anybody out in the public who would like to make a comment. Please raise your Zoom hand and we will coordinate that. Going once. Going twice. All right, no public comment. Before we transition to our executive session, our next meeting is going to be June 18th, starting at 9. We're going to do the same format. And our next meeting is going to be on Wednesday because of the Juneteenth holiday. So not our normal Thursdays. Dave, any final comments before we go to exec session?
Just the anticipated topics for 2 weeks from now are we'll talk about any proposed benefit design changes that could be in the mix for being embodied in the final rates that are presented publicly in July. So you might remember there's a 2-step dance. We describe any proposed benefit levers separate from the introduction of rates. Then we present the introductory rates, tie that together publicly, and then ask you to take final action on premiums. So we begin that multi-step dance with a public presentation of any benefit design changes that are on the table. We're anticipating having a presentation about Senate Bill 5083. That's the public employee affordability bill that we've been talking about. All session, it was the agency request legislation, and wanted to give more insights about it than just a title and a few verbal comments along the way from me and Kate along the process. So we're working on a full presentation to describe kind of the ins and outs of that bill and our agency's implementation of it. And then we will have a benefits 24/7 update because I committed to doing those monthly. And so that there's only one more meeting this month. We are doing this closing kind of activity comments for me before going into executive session to reassure the public that the only thing we're doing after exec session is gaveling out. So just kind of restructuring the agenda a little bit for that purpose.
Any questions for Dave? All right, here we go. Transition to executive session. There we go. We're going to transition to executive session, which is going to happen here in the Sue Crystal room for board members and included HCA employees. At this time, members of the public joining us in person at the Healthcare Authority, as well as employees not part of the executive session, is going to be asked to wait in the main lobby until we're finished with this executive session. You'll be called back in to join us, Sue Crystal, for the remainder of the public meeting, which is just gaveling out when executive session is concluded. So pursuant to RCW 42.30.110 subsection 1L, the board will now meet in executive session to consider proprietary or confidential non-published information related to the development, acquisition, or implementation of state purchased healthcare services as provided in RCW 4105.026. The executive session will conclude no later than 11:55 a.m. Board members, let's go ahead and take a quick break before we transition. If you're virtual, the link for this meeting was sent to you Tuesday around 12:45. We'll return to our public meeting only to adjourn. Thank you.
Hey Lou, can you have somebody send me the Zoom link? I can't seem
Yes.
to find it.
We got that for you.
Despite the very precise time, I don't know where it is.
12:45 and 2/10.
Exactly.
I don't know
I
how
wish
many
I wish
emails
my
you
tech
get.
skills were better, but
Yeah,
thank
no
you.
problem. We'll resend that to you. There we go. Well, we are back from executive session and this meeting is now ended. So thank you so much. Appreciate it. And Dave, thank you and your staff. Great presentation today. Good stuff. We're getting there.